HPV and cancer. What's the relationship? Find out on today's Vax Matters.
When talking about health matters and issues that impact every community, human papillomavirus, HPV, hits near the top of every list, and so does cancer. Today, we're exploring how these diseases relate to each other. And there's no better person to help us with this than Dr. Tina Stefanski, Regional Medical Director with the Louisiana Department of Health. Doc, welcome to the show. How are you?
Hey, I'm great. Thanks so much for having me and for covering such an important topic. I'm really delighted to be here today.
It is an important topic. Tell us a little bit about HPV virus and what sort of vaccines are available.
Sure. So HPV is human papillomavirus. It's a very common virus that's passed from one person to another during sex. And no matter what data you look at, it's very apparent that the vast majority, over 50%, some studies show 4 out of every 5 people at some point in their life are going to be exposed to HPV. So it's a very common virus. There's several different subtypes of HPV, about 40 different subtypes of this virus, and they can lead to things like cervical warts, to cervical throat cancer, anal cancer. So it's just a very important virus for us all to know about. And the most exciting thing about this virus is that it can be prevented through vaccination. So while we know there's a very important link, unfortunately, to things like cervical cancer, or again, anal, penile cancer, throat cancer, what we want people to know is that there's actually a vaccine that's available, has been available for years, very safe, and effective at preventing HPV infection.
And that's our whole goal here. And your goal, doctor, is to talk about the availability, that people are talking about this now, talking about HPV, talking about, I didn't realize that when you said 4 out of 5 people probably exposed in our lifetime. You stop and think about that. That's just about everybody in a room that you're looking at.
Sure.
But it is so good to be able, when you turn on your television, to have the commercials, to have almost a public service announcement with
Right.
the drugs or the vaccines that are available when it is so common. So may I just ask you, do most HPV infections, do they turn into cancer?
No, and so for most people, your immune system, if you're exposed to HPV, may take about 2 years, but for most people, their body naturally clears that infection.
I see.
However,
Okay.
about so again, so for most people, our immune system gets rid of the infection very, early on, very naturally within the first couple of years. But in some people, the body's immune system can't get rid of that infection, and it can linger over time. And if it happens to be one of those HPV types that can lead to cancer, it can turn your normal cells into abnormal cells and cancer. This happens in about 10% of, when we're talking about cervical cancer, about 10% of women with HPV on their cervix
Mm.
will develop long-lasting infection that puts them at risk for cervical cancer. So it's not everyone; it's actually a small percentage of people. But HPV infection is. There are no symptoms. You don't know that you've been infected with HPV. So most people who are infected don't know that they have it.
Wow.
And so the way that we can prevent that 10% of women from going on to develop cervical cancer is to prevent that infection in the first place, which is through vaccination.
Well, if you don't know, if there are no symptoms to let you know, then at what point in the process are you made aware that there is something going on? Is that by virtue of a screening for something else, or how do you find out?
Yes, exactly. So that's through screening. So, we also talk to women, there are steps that we can take to prevent cervical cancer, right? It's getting vaccinated, getting screenings, routine screenings. Those are really your best bets, is vaccination with regular screenings. And so for women, the screening is a pap test or a pap smear.
Mhm.
And most women are pretty familiar with that. It's a test that's conducted in a doctor's office or in a clinic, for example, in our health units. And the doctor at that point collects during your cervical exam, or they collect a pap smear. And without getting too technical, there's usually a pap smear that's collected, but we can also test for HPV at the same time. So maybe two tests that are run from that one exam. So you're not aware that that's happening, but talk to your doctor about when he collects or she collects that pap smear, or your nurse practitioner. What are they sending it off for?
Boy, that
But
really.
usually, yes, during the course of that test, we can identify HPV viruses, in particular these high risk HPV viruses. And so if that is detected during the course of that test, the other good news is that there's treatment that can be done to prevent progression. So again, we want people, and oftentimes when we talk about screening exams, same for mammograms, for example, oftentimes women are scared or apprehensive about getting screened because they don't want to know. They're
Yes,
scared
yeah.
about the consequences.
Mhm.
But again, the good news when we're talking about cervical cancer is that there's a treatment, and it's best, and there's even treatment for these precancerous cells. So when you have these routine screenings, the whole goal here is to pick up these precancerous cells, get treatment so you never go on to develop cervical cancer. So getting regular screening is really important. And based on your age, the doctor may tell you if you have a normal test, that your doctor, he or she may tell you, or your nurse practitioner, you don't need another screening, for another 3 or 5 years. It just depends on your age, your past history. So your healthcare provider will talk you through that. But screening is just tremendously important and very, very simple. And again, really important that there's an action that can be taken to prevent you from going on to develop cancer if you have precancer cells detected.
And, this is a part of a woman's routine healthcare scenario that, women do every depending, as you said, on your past history or whatever, every 6 months, every year, certainly, or depending on your sexual activity or not, and your age or not. And this is one of those great conversations to have with your doctor, to have with your OBGYN, to find out more and to see if there is any possibility of being at risk. And you touched on it, such an important point, doctor, when you said so many people, they're afraid of what they might find out. That's why I've had friends that say, "Oh, I'm afraid to go get a mammogram." Why? You're going to save your life possibly. You need to find out. Same thing with the pap smear going in, for your yearly examination. Find out what's going on with your body. You know your body better than anybody. And so this better than the doctor. That's why you have to have these honest conversations with doctors.
Can I ask a question from the perspective of the male audience listening here? Why is that?
Yes.
Why is that? Why would? And I know some of that exists to a degree with guys, but not at the level,
Mm.
because I've heard that before. Why is there such apprehension to find out if there's anything wrong?
I think it's the fear of the consequences. What does that mean, as far as the treatment? Or some people are just scared to know that they've got some serious health condition.
Mhm.
They are just scared to get that news. And we hear it again. You hear it with mammograms, colorectal screenings. We're talking about colonoscopies, X-rays for people who smoke. To look at lung cancer, and again here when we're talking about pap smears, I think it's kind of the fear of what then comes next. And the good news is in the field of medicine we've made so many advances, but it is still always best to detect something early on in the course. That gives you the best chance of
Absolutely. Yeah.
of having a long and healthy life. So when we're talking about cervical cancer, again, it's just great to know that these tests can actually pick up precancerous cells. It can actually detect if you've been exposed to one of these high risk viruses before it's had any chance of even altering your body's, your cells, your cervix. So it's the pap test and the HPV test are really, really important because again, and if you do them routinely or
Mhm.
regularly, then that's going to again be your best chance of detecting something at the early stages, even before it has a chance to again to turn into even precancers, just by being exposed to one of these high risk viruses. You again, it's just great information to have because it's going to give It's going to give you and your healthcare provider the best chance of coming up with some treatment or follow-up plan. And preventing cancer is always better than getting it.
Yes,
No
absolutely.
matter
Yes.
what someone's concerns are, preventing it, and again, prevention, when we're talking about cervical cancer, is getting vaccinated and getting regular screenings.
Well, Di, before you go on, I mean, Doc, you said earlier only about 10% of women who experience HPV actually have it turn into cancer. So that further underscores the necessity of screenings to catch it early, to deal with it, so that it doesn't become something that costs you your life. Correct?
That is absolutely correct. And again, as we said before, most people who become infected with HPV don't even know it. So this is something you have no way of knowing without being tested. And it's, again, such a common virus. Most people in their life are going to be exposed to it. And when we talk about vaccinations, that's why we want to vaccinate children early, before they become exposed, before they become sexually active, because again, that vaccination is going to prevent infection, or go a long way towards preventing infection. The vaccine doesn't treat the virus, right? So if you've already exposed, getting vaccinated doesn't help. The benefit of the vaccination is in preventing infection if you're exposed. And so that's why we talk about vaccinating children at 11 to 12 years of age. It's actually approved for children down to 9 years of age. 11 is when children come in for other routine vaccinations, and so that's why we also offer the HPV vaccine at that time.
How long has that been available for the adolescent? Because I know years past, it seems like this is something within the past. How many years, doctor? I wouldn't even know when the HPV, the vaccine, became available and now widespread and acceptable.
Sure, 2006, and
Oh, okay.
for me that doesn't seem like that long ago. I'm a pediatrician by training, and work with public health, and I still distinctly remember when this vaccine. Again, it doesn't seem like it was very long ago, but it's actually been
Yeah.
several years, decades. 2006 is when the vaccine was first kind of arrived on the scene, and this association between HPV and cervical cancer was made in the 1990s. So again, still for me a fairly new realization that most cases of cervical cancer are caused or linked to chronic HPV infection. And so, it's really exciting. This is a cancer preventing vaccine. And again, I think,
Mm,
we hope that we have more cancer preventing vaccines in the
indeed.
future. And
Wow.
so for parents, yeah, for parents to realize that by vaccinating your child, at this young age, you're helping to prevent them from developing cancer, and that's just it's so powerful.
It's interesting. I want to be able to catch something that we've talked about. So if you have been vaccinated, and whether it be a child or an adult, if someone is thinking, well, if I'm vaccinated, why do I have to be so consistent with my screening? So speak to that, because you one isn't a panacea. You want to be able to do both, right?
Correct. And so that is because, of course, as we talked about, there are over 40 types of HPV. There are 13 that are considered high risk. The vaccine covers about 80% of the high risk types that lead to cervical cancer. So there still is, it's not, there still is a risk of you being exposed to one of these other high risk types that aren't covered in the vaccine. And so, and the vaccine continues to evolve, and more types are covered. But for that reason, because you need to, it's vaccination plus these routine screenings, is what's really important. And if someone's vaccinated later in life, they could have been exposed to HPV, one of these high risk types, before vaccination.
Well, can you be vaccinated later in life, or does it have to be for the adolescent or the preteen? Can it be as a teenager, an adult, or where does that criteria end?
Sure. And so the vaccine is approved from 9 years of age through age 26. So people 27 and older don't fall into that, or I should say approved, recommended. It's recommended for children up through individuals, children starting at age 9 up through 26 years of age. However, someone who's older than 27 might choose to be vaccinated. Again, that's a conversation to have with your healthcare provider. The reason we encourage and really want to vaccinate people early is it's so that we can vaccinate them before they're exposed. So older individuals will likely not be offered the vaccine. But if it's something that someone's who's listening to this is 30 years old and is still interested in the vaccine, talk to your healthcare provider about the HPV vaccine.
Hmm. Other than HPV, are there any other causes of cervical cancer?
So HPV is definitely the most you really thought to be the big driver behind cervical cancer. There are some other high risk factors, and some of these might be kind of in combination with HPV, or maybe not. But some of those other high risk things that might lead to putting you more, or there are some other factors that might lead you to be more at risk for developing cervical cancer. Smoking, for example, infection with chlamydia. Those are two other kind of behaviors or conditions that might lead someone to be at higher risk. And so, and also having a weakened immune system. Some individuals, certain hormone treatments, and that's again something you need to have. You need to talk with your doctor about. I'm not an expert in hormone treatments, but there are some hormone treatments that could put a woman at higher risk. So, but definitely the most common HPV is certainly a proven link to most of the cervical cancers, but other risk factors: smoking, chlamydia infection, a weak immune system, and perhaps even being overweight, or all other things that might lead you to be more at risk for cervical cancer.
Well, are there other
And again,
I'm sorry, go ahead.
no, and I was gonna, and also someone who who is not routinely tested or
Mm.
screened. So, so that is actually considered high. If you're not routinely screened for cervical cancer, then that is considered a risk factor.
Mhm. And I would imagine, the folks listening to the conversation today, they may have, formed a question in their mind about, are there other types of cancer that HPV can cause besides, of course, what we're saying here, the cervical cancer? And can men be impacted as well?
Yes, and so there are other types of HPV that can lead to cancers. So we've talked about the cervix, the anus, um, your vagina in women, penis in men, and then throat cancer or oral cancer. So, so there are, yes, those again, 5 additional types that can lead to those cancers, and then also a few types of HPV also covered in the vaccine that can lead to about 90% of genital warts. And so, to be clear, someone listening might have had genital warts. The HPV types that cause genital warts are not the high risk types that are linked to cancer, but again, the HPV vaccine does help to prevent genital warts when you consider that 90% of the genital warts types that cause genital warts are covered in the vaccine. So it can help to prevent cervical cancer, genital warts, cancers of the anus, vagina, um, uh, penis, and oral cancers. And so just so many tremendous reasons, right, to get
Mhm.
vaccinated, and which is why we talk a lot about vaccination for girls, or people might listen and be thinking about, oh, I need to, my daughter needs to be vaccinated. It's very clear, the link between cervical cancer and HPV, but young boys also need to be vaccinated because of this link to not
Oh.
only genital warts, but cancers of the penis, oral cancers, and the anus. So again, really important that girls and boys at that adolescent visit get vaccinated, and it's a series of 2 vaccinations. So you get vaccinated, they'll get that 1 dose, and then about 6 months later, come back for the second dose. Now, if you start your vaccinations after the age of 15, then it's a 3-dose series.
And no booster. You don't need anything once you have the vaccination.
Correct.
Okay.
At this point, there's no need for a booster, right? You get that 2 or 3 dose vaccination series, and that is it.
And since it's relatively new from 2006, I mean, that is, in the lifespan of talking about all the vaccines that we've talked about on our podcast of Vax Matters, what has been the thought about parents? I'm sure that as you said, the pediatrician aspect, parents probably asked a lot of questions when this was first maybe introduced back in the early 2000s. What did you, as a physician, as the child's physician and the person the parents would turn to, what did you say to them to make them understand the importance of this vaccine? And this wasn't something that was just maybe I don't even know. I have no children, so I don't even know what questions I would ask. So could you kind of walk us through that a little bit?
Sure. Early on, I distinctly remember this was in the parent in the minds of some individuals, some adults. There was concern that this vaccine might condone young children, having becoming sexually active, and so I think a lot of parents were concerned that the message that this offering a child a vaccination, so this type of vaccination at such a young age might send a message that the parent is condoning sexual activity in a young child, which of course absolutely not the
Right.
goal.
Right.
And
Mm.
so, what our messaging to parents is that, look, we want to vaccinate your child before they become sexually active. This vaccine is not going to be nearly as helpful once they're becoming sexually active. It's just a timing. It's when we're offering other vaccinations, so it makes sense to offer this vaccine at age 11. You're offering it with other childhood vaccinations, so explain to your child, hey, this is a cancer preventing vaccine. And I think that over the years, there was again a lot of concern and a lot of dissension earlier on with this vaccine, which actually has led it. States have not added this vaccine, for example, to the required group of
Mm.
vaccinations that kids get for entry into school, because there was such concern by parents about the message that this might be sending to their children. But again, I do think that parents and adults are certainly now realizing, hey, this is a cancer preventing vaccine. It works best when given to children early in life before they're exposed. And that's really the message that like when we talk to kids, you don't want to, and we try to figure out how to message this. I guess my message to parents would be, you certainly don't want to withhold a vaccination from a child that's going to protect them or prevent them from getting cancer. What if they develop cancer 10 and 20 years down the line, and you
Mhm.
think, oh, there was something that I should have done as a parent. No one wants to deal or have that happen. And so I think just the message, this is a cancer preventing vaccine. And we're so fortunate to have such great availability of a vaccine that can do so much,
And as you
and that
said,
has done so much. Another message to parents is that, like, since we do have these decades of history with this vaccine, it's that this vaccine works. And so, for example, among teen girls, infection with the HPV types that cause most HPV cancers and genital warts have dropped 88%.
oh my
Wow.
gosh,
Yes, the infection with the HPV types that cause most HPV cancers and genital warts has dropped 88%. So that's
that's proof
tremendous.
positive.
And
Yeah.
yes, and when we
Mhm.
think about oropharyngeal cancers, HPV is thought to cause 70% of the oral, or that's kind of oral and throat cancer. So it's just a really important vaccine, and again, we know it works. We've been using it for decades. It's a safe vaccine, and so I think that's really the message to parents. We've what there's just only benefit to this vaccine.
And I think too that when you talk about that you can say it's a cancer preventing
Right.
vaccine. Wouldn't it be wonderful if all those cancers out there that so many people are impacted with right now, that there would be a point in time, maybe not in my lifetime, but you can say, this for this cancer, we have a vaccine for you. And why would you not take advantage of that? And that's what you're saying today to parents for their young people, for their children. take advantage of that. This is not anything that we need to mess around with for young people.
Yes, exactly. If hopefully the future, in the future we'll have other cancer preventing vaccines. But for now, this is the only vaccine that we've got to prevent cancer,
Yes.
and just how when administered prior to exposure to the vaccine to HPV, because once someone is exposed, the vaccine is not helpful. It is only helpful in preventing infection if you're exposed,
So
and
that's
so
an important
that's that
point.
that's
Yeah.
really that's the reason behind vaccinating children at such a young age. And in Louisiana, we have the fifth highest cervical cancer mortality rate, or that's the rate of dying from cancer in the United States. So, we really are trying to get this message out about HPV vaccination, because we can do better. This is in large part a preventable cancer. And so vaccination, regular screenings is going to help us to most importantly save the lives of men and women, and improve those rates. And I do also want to say there is a disparity when you look at race. So in Louisiana, Black women do have a higher rate of cervical cancer compared to white women, and a higher rate of dying from cervical cancer compared to white women. So we want all everyone to get vaccinated,
Sure.
but we also want mothers, and individuals, African American, to know that they do have a higher incidence of cervical cancer and a higher rate of dying from cervical cancer, and here in Louisiana. And so it's really, really important to have those discussions with your child's doctor. If you get your vaccinations at a parish health unit, talk to the nursing staff there. It's again, we definitely understand that people need to be able to ask questions, and have good, open, honest conversations. And so certainly seek out a trusted healthcare provider to ask your questions about this vaccine, because again, you could be saving your child's life, and protecting them from developing cancer, and of course, genital warts as well.
We've had so much fabulous and information today that
Yeah.
we all need
Yeah.
to know.
Yeah.
And it just is so worth just emphasizing the importance of everybody being on the same page. The parents and some of the grandparents. We have a lot of grandparents raising
Raising
their
kids. Yeah, that's
grandchildren.
right.
And with the doctor. So, doctor, is there anything as we wrap up our podcast today? Anything that we have not touched on, or that you feel that you would like to say, maybe another couple of minutes, say something else as we end today? We don't want, this is important, we don't want to end with something unsaid. Is there anything that you can think of that you would like to say before we close?
No, just that, again, prevention works. So preventing there, we have the tools to prevent cervical cancer, to greatly, to prevent most of the cases of cervical cancer. And again, that's HPV vaccination, and getting your regular pap smear, in addition to avoiding smoking. Um, but again, prevention works. Like we said before, preventing cancer is always better than getting it. And if you have any questions about vaccinations, your pap test, talk to your healthcare provider, talk to one of our parish health unit nurses in public health. There's just lots of good information out there. The Centers for Disease Control, the American Cancer Society, just lots of great information about cervical cancer and how to prevent it. And again, that's the key, right? You can actually prevent cervical cancer. When unfortunately, there's a lot of cancers that we're not able to we're not able to so easily prevent. In the case of cervical cancer, there's a vaccination and screenings that can help to save your life. So we just encourage everyone to take advantage of both of those.
That is the bottom line, saving as many lives we possibly can. And that's what we want to do here on this podcast. Thank you again, doctor. You were fabulous. The positive, the encouraging information that you gave us today, and all of our listeners, we can't tell you how important this is and how much we appreciate it. And that will wrap it up for us today. Thank you for listening, and please stay tuned for our next Vax Matters podcast episode.